Ladies and gentlemen, distinguished guests, I think it's time to start today's conference. Welcome to the launch of the comprehensive report regarding health of refugees from Ukraine. My name is Magdalena Ambroch, and on behalf of Statistics Poland, I will guide you through today's conference. This important event is the result of the collaboration between Statistics Poland and World Health Organization. We are meeting here to delve into the findings of the second round of the survey conducted among refugees from Ukraine for purpose of recognition their healthcare needs. After 2 years from the first pioneer survey, we have developed the methodology and we are enriched with the new experiences in data integration. And these experiences we would like to share with you and discuss today as well. Our meeting takes place in a hybrid format. I would like to welcome our guests gathered here at Statistics Poland, guests who joined us via WebEx, and our viewers following the live broadcast on YouTube channel. I am pleased to welcome our host, Dr. Dominik Roskrut, President of Statistics Poland and of the International Association of Official Statistics, and Dr. Nino Berzulli, the World Health Organization representative and special envoy for Ukraine emergency response in refugee hosting countries. I would like to extend a special welcome to Dr. Wojciech Konieczny, Secretary of State at Ministry of Health, Mrs. Irina Vereshchuk, Deputy Prime Minister, Minister for Reintegration of the Temporarily Occupied Territories of Ukraine, and Mrs. Marek Kolanko, Data-Driven Solutions Director at MasterCard. I would like also to welcome Civil Servant Director of Poland, but I think she's, yes, sorry, Mrs. Director, Mrs. Anna Borowska, Professor Marek Cierpiał-Wolan, the Director of Statistical Office in Rzeszów, representatives from ministries, including the Ministry of Family, Labour and Social Policy, the Ministry of Health, the Ministry of Interior and Administration, and the Ministry of Science and Higher Education. Moreover, I would like warmly welcome representatives from the embassies, Nobumitsu Kamiyo, First Secretary of Embassy of Japan, Katarina Stechlikova from the Embassy of Slovak Republic, and Anke Siebold and Karolina Witek from German Embassy. I would like to welcome representatives from the United Nations High Commissioner for Refugees, United Nations Information Center, International Organization for Migration, representatives from the academic community, Ludmiła Momotiuk from the National Academy of Statistics, representatives from the Institute for Demography and Life Quality Problems of the National Academy of Science of Ukraine. Now I would like to ask our opening speakers, Dr. Dominik Roskrut and Dr. Nino Berzulli, to share their insights and set the tone for our conference today.
Thank you very much. It's my pleasure to welcome all of you here in the room and also those that are connecting with us over the internet. I want to exaggerate if I say that's a very important day for this institution, but for us as statisticians that try to serve the role of someone who is delivering information that is necessary to shape current policies. We feel this obligation and we take it very seriously. And this is the very good example of how we react to the things that happen at the moment. And of course, it's a big pleasure to host you all here and to have this kind of a summary of the next steps of the things that we've started already 2 years ago, together with the WHO initially, also being supported financially. Now we're continuing to do the work without any additional financing, but we consider it as a very important part of our everyday duties. We had this pleasure and challenge, of course, challenge in the terms of the problems that we have to solve, measurement problems, but we have this pleasure to solve them together, working along the lines with the WHO, our institutions, but a set of other institutions that were helping us throughout this process to deliver the information that I think is crucial for the current policy-making context and for us as a society to be well informed about the things that happen around us. I'm very satisfied that we had enough capacity and we've been able to build a new capacity in order to solve the issues of measurement. In this regard, these are not simple things. This is not simple surveying as everybody knows us for doing every day. This is something that required linking and acquiring and linking different data sources, including those data sources that we have not been traditionally using extensively among statistical offices around the world. In this regard, we're very happy that we have yet again confirmed that we are at the top-notch class of statistical offices globally, being ranked second in one of those rankings, but also delivering something that is an outcome of linking data from credit cards transactions, from telecom operators, classical surveying data, but with the tricky sampling frames. And this is really a big achievement that we want to share today with you in the context of the results that we get, because those are the most important. If we can actually, thanks to those numbers, help real people, and this is the ultimate objective, but we are happy that we can also share our experiences with the other statistical systems around the world in terms of how to deal with the problems like that. And that's something that really is a next step after the seminar like today. We've been already successfully organizing twice a seminar at the United Nations premises in New York during the Statistical Commission, sharing those experiences with the other statistical systems around the world. There was a lot of traction, a lot of interest in that. We have some other countries committed to follow our examples, and I think that that exercise is going to be bigger and bigger in time. Anyway, I would like to thank all of those that have been collaborating in preparation of the work. I would like to thank those that are in the room. There is one important missing person here. I need to mention it. It's Rifat Hussain from WHO, who was scheduled to come for this meeting. He was, since the beginning, something that we call in Latin here in Polish language, spiritus movens at the side of WHO. He helped us a lot in collaboration in setting up these linkages in between the two institutions. So I'd like to thank him if he's online. Thank you, Rifat, very much. The biggest challenge was of course in combining different data sources, and I'd like to take this opportunity, sorry for that, but also to thank my team in Rzeszów office. These are amazing people, the director, Professor Marek Cierpia-Wolan, and our colleagues that are sitting there that will be presenting later on. And the products of their work, they did amazing work. They're amazing statisticians, and we don't want to provide their names so you don't steal them from us. I'm kidding, of course, but their example of what they did, you can actually check now yourself. If you're online, take a look at the address that we have provided to you on the screen, healthofrefugees.stat.gov.pl. This is the living dashboard of the results that provides you near real-time data, daily data coming out from the production process that we have set up together with WHO. We're very proud of that. So just to quickly sum up my short intervention, again, thanks to all of that, to all of those that helped to make it happen. Thanks to our all distinguished guests, and thank to all our panelists and participants of this seminar today. Thank you very much.
Dzień dobry, and good morning, everyone. Very nice to be here at the Statistics Office headquarters, and thank you, Dominic, for outstanding partnership and your leadership in developing innovative measurements, bridging the need for the health information and the statistics for the refugee health response, which is really excellent partnership we're very proud of. Your Excellencies, Secretary of State, Ministry of Health, Mr. Wojciech Koneczny. I know that we have dignitaries connected online as well. Ladies and gentlemen, dear colleagues, on behalf of the WHO Regional Office for Europe, on behalf of the WHO office here in Poland, and the Regional Director for WHO Europe, Dr. Hans Klug, is supposed to address us online, but he's now in Central Asia and attending very important health investment forum, so he could not join us online, but please accept his warm welcome and the appreciation of the work in the partnership with Statistics Poland that we have. So I extend the warm welcome to all of you who are in the room, but also everyone who is joining online us. And I know that there are about 200 people joining us virtually, so warm welcome to all of you. All the refugee hosting countries that are joining us online. So this is really really testimony that the collaboration between the countries, diverse partners and the sectors and institutions to address the health needs of refugees, women, children and men who were forced to flee their country is very important to have this collaboration. There is unprecedented solidarity that has been shown by Poland, providing generous support for Ukrainian refugees. And this is, really very much appreciated for this openness, providing the benefits to the Ukrainian refugees, same as the Polish people and the Polish population benefit from. To date, there has been, as you know, over 35 million border crossings from Ukraine and nearly 28 million to Ukraine since February 22, which is actually indicating the pendular movement. The European region now hosts almost 6 million recorded refugees from Ukraine, and nearly 5.8 million have registered for temporary protection, asylum or national protection schemes. And in Poland alone, there is 1 million Ukrainian refugees registered under temporary protection directive. Poland, neighboring countries, refugee hosting countries, receiving countries, we work WHO hand in hand with the ministries of health, with the health partners, with the institutions, different sectors to truly address the multifaceted health needs of Ukrainian families, facilitating a comprehensive end-to-end approach, ensuring that they have an access to primary and the specialized healthcare services, and strengthening mental health and chronic diseases services that they need. But as you know, we moved from the acute phase of crisis to the protracted emergency, and to understand the evolving needs of Ukrainian refugees, the needs of the most vulnerable among the refugee population, the data, the integration of the data from the refugees into the information systems, and especially the timeliness of data, because we know that when we do the surveys, it takes 6, 8, 10 months, sometimes to get the data. So what is important to get the real-time data, and what Dominic was referring that, and this link again, I want to emphasize and refer everyone to this the website that provides real-time data on the health needs of refugees. It's truly unique, was a unique partnership that we were able to develop. And this is of critical importance because it helps us to do the evidence-informed decision-making in public health. So today, together with Statistics Poland, we are going to present an example of these data-driven insights for advancing health and statistics to leave no one behind, tackling the needs of specific vulnerable populations. And surveys in 22 and 23 with data innovations that Dominic was referring, and we're going to hear more detail the methodology of this data integration, provide important insights into the refugees' health status, refugees' health needs, and drivers and the barriers of access to the healthcare services. This innovative data methodology includes the quantitative data collected from over 4,000 refugees in households in temporary accommodation establishments at the Polish-Ukrainian borders. It is complemented by the qualitative research, behavioral insights to actually understand the experience of Ukrainian refugees when they were accessing the healthcare services, and importantly, integrating different administrative data sources and the big data. And I know that the MasterCard representative is here, so I would really like to thank for this collaboration, these innovative partnerships that we were able to build together. Big thanks to Ukrainian refugees who were participating in our study, in survey, to border guards for the data, to MasterCard again, and to mobile network operator for these collaborations. We are going to have the session presentation on findings from the research from our study, which compares 22 and the 23 data, and you're going to hear this from my colleague from the WHO headquarters, this detailed presentation, but already I can point out and highlight to some positive developments. Refugees having the increased access to healthcare, gain the better understanding of the Polish healthcare system. As you know, as many of you know, initially they had the difficulty to understand, to navigate the Polish healthcare system, but it is less prominent now. Refugees expressed dissatisfaction with the care provided by the nurses and the doctors, referring to the empathy and the quality of care provided by the Polish healthcare professionals. And importantly, the comparison of the 22 and the 23 survey actually points out that there is a clear reduction in the out-of-pocket expenses, especially the expenses that are over 25% of the savings on health. But of course, the challenges remain, and these challenges relate to the specialized access to the specialized healthcare, long waiting times, and these are the similar challenges that the Polish population is facing: out-of-pocket expenditures on the medicines, language barriers that are particularly prominent among the most vulnerable refugees. These findings demonstrate, colleagues, that there is, in addressing the long-term needs of Ukrainian refugees, health must remain a top priority and the core function of the emergency response in the context of the protracted emergencies. We have been working as a WHO hand in hand with the Ministry of Health, with the government, to provide, to support in the response, in the health response, as well as many refugee receiving countries, refugee hosting countries, to address the systemic challenges and immediate health needs of refugees. And WHO will continue this partnership, will continue this support to the government, to the Ministry of Health going forward. Finally, I would really like to thank again Statistics Poland and many colleagues with whom we have been working and developed this partnership over the last 2 years. Professor Marek, Director of the Rzeszów Statistics Office, and many colleagues that I don't want to miss any names, but you all are here. It's truly a fascinating partnership, and we really would like to thank you for filling these blind spots in health information systems, which is very important, for us to have, and for all of us, for public health decision making, to have the disaggregated data for refugees, for migrants, in order to understand, their needs and the access to the healthcare services, leaving no one behind. Thank you so much.
Thank you very much. Now I would like to give the floor to Dr. Wojciech Konieczny, Secretary of State at Ministry of Health.
Dziękuję bardzo. Thank you very much. Panie prezesie, dziękuję za zaproszenie. I would like also to thank WHO country representative Dr. Nina Berzuli for co-organizing this conference. From now I like to speak Polish because I want to be well understood. Dziękuję za zaproszenie Ministerstwa Zdrowia Rzeczpospolitej Polskiej do udziału w konferencji z okazji publikacji raportu na temat zdrowia uchodźców ukraińskich.
I would like to thank you very much for inviting the Ministry of Health to this particular conference that marks the publication of the report entitled Health of Refugees from Ukraine.
Po wybuchu wojny w Ukrainie w lutym 2022 roku Polska jako pierwsza pośpieszyła z pomocą swojemu sąsiadowi. Rząd Rzeczpospolitej Polskiej podjął wówczas działania mające na celu pomoc obywatelom ukraińskim, głównie kobietom, dzieciom oraz osobom starszym.
After the war against Ukraine broke in February 2002, Poland was the first country who took steps to respond and to help its neighbor. The government of the Republic of Poland took steps in order to assist Ukrainian nationals, mostly women, children, and elderly individuals.
12 marca 2022 roku Sejm uchwalił ustawę o pomocy obywatelom Ukrainy w związku z konfliktem zbrojnym na terytorium tego państwa, na mocy której obywatele Ukrainy, którzy przybyli do Polski po 24 lutego 2022 roku, mogą korzystać z wielu świadczeń opieki zdrowotnej na takich samych zasadach jak obywatele Polski. Obecnie funkcjonowanie tej ustawy zostało przedłużone do końca września przyszłego roku.
On the 12th of March 2002, the Polish Parliament adopted the Act on Assisting and Supporting Ukrainian Nationals due to the armed conflict on the territory of their country. And based on this particular act, Ukrainian nationals who arrived in Poland after the 24th of February 2002 can enjoy many healthcare services equally to Polish citizens. And currently, this act has been extended till September next year.
Zgodnie z danymi Narodowego Funduszu Zdrowia od lutego 2020 roku do marca 2024 roku, według stanu na 12 czerwca, 151 513 pacjentów ukraińskich, to jest ponad 98 tysięcy dorosłych i 53 tysiące dzieci, zostało przyjętych w 1619 podmiotach leczniczych, a dodatkowo w ramach podstawowej opieki zdrowotnej przyjęto 452 297 pacjentów oraz w ramach ambulatoryjnej opieki specjalistycznej 178 684 pacjentów.
According to the data coming from the National Health Fund, between February 2002 and March 2004, and the data we have is as of the 12th of June 2004, we had 151,513 Ukrainian patients, which are 98,066 adults, and 53,447 children were received in 1,619 medical facilities. And additionally, primary care facilities received 452,297 patients, while outpatient specialized care facilities received 178,684 patients.
Tutaj chciałbym jeszcze zaznaczyć, iż również włączyła się w to prywatna ochrona zdrowia, lekarze przyjmujący w prywatnych gabinetach, których nie mamy odnotowanych w statystykach NFZ-u, a wiemy, że udzielali darmowych porad w różnych specjalizacjach, w różnych specjalnościach, za co również serdecznie dziękujemy.
Also, there have been some developments from private healthcare providers. And we do know, even though it's not included in the National Health Fund statistics, that private healthcare facilities also helped refugees, Ukrainian nationals for free. Doctors, physicians, and healthcare professionals of all kinds of specialties delivered consultations and visits free of charge.
Ministerstwo Zdrowia, które reprezentuję, również aktywnie uczestniczy w działaniach pomocowych od wybuchu wojny 11 marca 2022 roku. Minister Zdrowia powołał pełnomocnika do spraw przeniesienia w celu kontynuacji leczenia poza granicami Rzeczypospolitej Polskiej pacjentów ukraińskich przebywających w Polsce w związku z konfliktem zbrojnym na terenie Ukrainy.
The Ministry of Health, which I represent, has always and also been actively participating in all those steps to assist Ukrainian nationals, Ukrainian refugees. On the 11th of March 2022, the Minister of Health appointed a special representative for transfer of care and continuity of care so that patients can continue care even if they are outside of the Republic of Poland. So patients who fled into Poland will have care continuity provided thanks to our activities if they need to be moved outside of Poland.
Do zadań pełnomocnika należy m.in. koordynacja współpracy pomiędzy Unią Europejską a Polską w zakresie przeniesienia pacjentów ukraińskich przebywających w Polsce, których dalsze leczenie długoterminowe ma się odbywać w innym kraju członkowskim Unii Europejskiej lub Europejskiego Obszaru Gospodarczego. Do 24 czerwca 2024 roku w ramach tego mechanizmu relokowaliśmy 220 pacjentów ukraińskich do 14 krajów europejskich.
This special representative coordinating transfer and continuity of care of Ukrainian nationals is there to coordinate actions between Poland and the European Union as far as transferring Ukrainian patients staying in Poland, whose long-term care is supposed to be delivered also in other EU member states or on the territory of the European Economic Area. As of the 24th of June 2024, this mechanism allowed us to relocate 220 patients, Ukrainian patients, to 14 European countries.
Ministerstwo Zdrowia było również pomysłodawcą utworzenia Medivac Hub Jasienka. Powstał on w bliskiej odległości od lotniska w Rzeszowie, aby wspierać system ewakuacji medycznych, tzw. Medivac. Jest to miejsce, gdzie znajdują schronienie niezbędną asystę medyczną pacjenci ukraińscy będący w podróży do ustalonego miejsca w państwie członkowskim Unii Europejskiej oraz osoby im towarzyszące. Hub oferuje również możliwość przyjęcia pacjentów ukraińskich powracających po zakończonym leczeniu oraz zmianę miejsca pobytu.
The ministry also, and the special representative from the ministry also helped design the idea of Medevac Hub Jasionka. This particular hub was created to support the so-called Medivac operations, where patients were transferred to receive care in other countries. This particular place, this Medevac Hub Jasionka, located conveniently close to the Rzeszów airport, is a place where Ukrainian nationals who need medical assistance can find shelter, can find support, and can be relocated to their location on the territory of the European Union or the EEA, along with their accompanying individuals. This hub also can receive patients who come back after treatment, and it hosts necessary healthcare personnel.
Od początku działalności we wrześniu 2020 roku do czerwca 2024 roku z pobytów w hubie skorzystało 1603 pacjentów i 644 osoby towarzyszące.
From the moment the hub was created in September 2022 till June 2024, over 1,600 patients received assistance there, with over 600 accompanying individuals.
Strona polska była wielokrotnie proszona przez partnerów międzynarodowych o dzielenie się swoimi doświadczeniami na polu organizacji efektywnej pomocy uchodźcom ukraińskim. Mam nadzieję, że dzisiejsze spotkanie również stworzy możliwość nawiązywania współpracy w tym zakresie.
Poland has been since this conflict broke, has been asked on many occasions by many international partners to share its expertise as to how to efficiently and effectively assist Ukrainian refugees, Ukrainian nationals. Hopefully, today's meeting, today's conference will also be an opportunity to extend our collaboration in this regard.
Wierzę, że umiejętne zebranie i analizowanie danych dotyczących stanu zdrowia i potrzeb zdrowotnych Ukraińców w Polsce pozwoli na lepsze planowanie oraz zapewnienie uchodźcom lepszego dostępu do usług zdrowotnych. Z przyjemnością zapoznam się z przygotowanym przez Państwa raportem.
I believe that effective data gathering and data analysis will allow us to offer even better access to Ukrainian refugees to healthcare, and I'm very happy to have this opportunity to get acquainted with your report.
And I like to apologize because I must go back to the Polish Parliament. I have unfortunately not time to stay here. So thank you very much. I wish you a good discussion and good time in Warsaw. Thank you very much.
Thank you very much. We all are looking forward to acknowledge the key findings from the second round of the survey. So now I give the floor to Dr. Saverio Bellizzi from the Health and Migration at WHO.
So good morning, ladies and gentlemen and honorable speakers. My name is Saverio Bellizzi, and I am a medical epidemiologist from WHO Geneva headquarters in the program of health and migration. It's a great pleasure to be here, and as Dominic said, we were involved since the very beginning. Great collaboration. I'm here to replace Rifat that, as Dominic said, was since the very beginning under the leadership of the Minister of Health and the Statistics Office leading this fantastic, innovative experience. And what I would like to say is that the innovative experience, and this is not just a report, I believe this is just a starting point for an experience that should go on. So while I wait for my presentation to be projected, excellent. And thank you again. So, since I come from Geneva, so the global perspective of health and migration, I wanted just to open the discussion with a few slides of this important phenomenon that is happening. Is not new, but it's increasing more and more. So it's becoming more and more, eminent, also from the public health perspective. You can see quite clear here that more than 1 billion persons today are on the move, which means 1 out of 8 persons in the world are people that are either refugees or migrants or internally displaced. We have 300 million international migrants, 100 million that are forcibly displaced, and 36 million are children. I don't want to repeat the different figures that were already, mentioned by the representative, by Nino, but as you can see here, 1 million that are under temporary protection in Ukraine, here in Poland, and all the different numbers that summarizes the big movements in and out due to the Ukrainian crisis.
Cześć, Aniu.
There are already questions, I guess. Just a very short mention to the fact that last year we published the first world report on migrants and refugee health. And with this slide, I would like really to emphasize the importance of the health needs of migrants and refugees that are influenced during the different phases of the migration, pattern, from pre-migration to transit to arrival and to also to return phases. And each of these transition phases, of course, have different characteristics, different features that are going to influence the status of migrants and refugees. So within all these different phases, we need always to consider what are the socio-economic determinants, education, working condition, housing conditions, and so on. So this is why, again, it's so critical to have all the possible sources of data. And this is why, again, the experience here in Poland was particularly fruitful and innovative in bringing together different sources of data that might be also an evidence of the different social determinants that affect the health of these people on the move. I'm starting giving, I will be really concise in giving the main points and main results of this experience, especially in 2023 compared to 2022. But I wanted to start by highlighting the governance aspects of this experience. So the collaborative effort between the health and the statistical agencies demonstrate immense gains in partnership, in advancing data-driven humanitarian responses, ensuring that no one is left behind in time of crisis, but both in the acute situation, but also in the continuing situation. And what I would like also to highlight is that this is even more important, this kind of partnership and governance, structure, when there is a big will to develop innovative solutions to address even better the health needs of people on the move. I will leave the specificity of the methodological aspects to the following presentation by colleagues of the Statistical Office, but I wanted just, to summarize or to kind of preempt the important concepts around the methodology of this experience. Quantitative, with data collected, quantitative data, especially at the border, for 4,800 refugees in different, households and temporary accommodation. Qualitative, so here the very also innovative approach, if you want, to complement the quantitative with the behavioral insights. So really to understand from a qualitative point of view the barriers and the satisfaction to health care, access, and then again the integration. And the integration here is, on one hand, the capacity. It is, again, something quite unique because in charge of country support, I'm going to review different systems in different countries of the world. I was recently in Estonia, for instance, dealing about the Ukraine crisis. And one of the points we kept on raising is that the need of bridging the data gaps by bringing together, the sources of different agencies. And this is really the added value of this experience. Plus, of course, the big data. The big data about population movement coming from the experience of MasterCard, but also the mobile telephony. Few points about the findings. Now, before jumping in the main findings, it's always good to understand what is the profile of the population that was interviewed. And you can easily see here that 65% were females, comprising 3/4 of the adults population, and almost 50% were children under 18 years old. The majority of women fall between age of 18 and 54. You can see when comparing 2022 to 2023 that the composition of the age categories, but also of the gender population, are quite constant over time. And so this is very, very important also to interpret more accurately the findings about health status. And when you look at the findings, comparative findings between the type of healthcare needed, you see that basically the acute illnesses increases in 2023 based on the findings, while the chronic illnesses showed a reverse, pattern. With other aspects like dental services, sexual health, orthopedic conditions, and so on remain quite stable. Now, a possible interpretation for these differences in acute illnesses is that both surveys were done at different time period, while the 2022 was done during the month of July, August. The following one in 2023 was more during the winter time. So this might be an explanation for the differences in terms of prevalence of acute illnesses. On the other hand, when you look at the cardiovascular, at the chronic illnesses, you have on the right-hand side of this slide, the disaggregation by the different conditions. Cardiovascular diseases, for instance, that decreased, diabetes decreased, cancer, all of them decreased. And this again might be a representation of the fact that people were having a better access over time, and so better control of the different situations. Here we have again a pie chart comparing, the access to the healthcare. You can see that healthcare needs reported over the last 30 days before the interview marked an increment of 12% points that reflect a shift on the healthcare, needs and access, but also a better, flow of information, possibly in the different channels that are utilized by the refugees. So better understanding on how the system works. This is quite typical in all the different systems when a refugee comes for the first time, with difficulties in understanding, the structure of the system. And then over time, depending on the different channels of information they use, they understand better and they go inside. But this is also, I would say, an important element to take into consideration in reinforcing more and more the risk communication, community engagement of refugees and migrants, because based on this data, there is a continuous need to tailor messaging for improve even more the access to healthcare. Barriers to healthcare, and this reflects, as also Dr. Nino was saying, an alignment with the situation also for the Polish, citizens, and the long is now by far the most important barrier, and increases importantly in 2023. Most probably because, refugees are better access, but also are experiencing the nature, the difficulties that is of the national health systems. Cost of services, I would like to point out this important point. You see a decrease as a barrier. And again, this is an important aspect that usually one of the main barriers for refugees and migrants across different countries. In fact, if you look at the comparison between 2022 and 2023, there is a clear reduction of the out-of-pocket expenses. Even in the opening remarks was pointed out these important aspects. There is basically a reduction of the 50%, the orange part of these two different bar charts. Still something to take into consideration for future policy making. This is evidence, and this is also to take into consideration for the local population, for Polish, especially vulnerable populations. In the 2023 surveys, there was a kind of categorization of the different services that cost more. And so it's quite an interesting and useful, again, disaggregation evidence, where you can see that dental services are the ones that are more costly. So there is a kind of barrier also there, 33%. While physical traumatic conditions and acute illnesses are the ones where the least was paid. So these again reflect different possible policies and the organizational structure of the health system. Vaccination, clear improvement. There was a quite important thinking at the beginning of the crisis because average immunization rates in Ukraine are lower for the young vaccination, for the compulsory ones. And a big effort in that end. So you can see a quite clear improvement in MMR, DTP, and the polio vaccination rates. And the percentage of unvaccinated children decreased by 50%. I would like to spend just a few words, quite important, on mental health, because mental health is one of the main health topics that usually affects across the different categories of migrants and refugees. Now, and mental health is of a particular, difficulty sometimes to interpret, even because there is all an area of stigmatization and cultural barriers that prevent not only the access to healthcare, but even to report and to identify specific needs. And this is also quite confirmed from the findings because a minority of respondents had used mental health and psychosocial support since arriving in Poland. And this is possibly linked to a lack of need, cultural factors, but also reluctance to acknowledge the need of therapy. The 2023 survey showed a disproportionate impact on mental health for refugees aged older than 65 years that are, I would say, in trouble to conduct daily activities. And I would say concerning, finding was the fact that there was a noticeable increase in the 5-14 years old age group, where there was an increase in the signs of anxiety from 6% in 22 to almost 9% in 2023. So there is a clear need of specialized care around mental health. So where do we stand now? What is the direction? And it's clear from all these findings that there are specific evolving needs. So the latest survey indicates a growing demand of specialized care. This shift underscores the need of continuing investing in healthcare system to support the ongoing needs, not only of the Ukraine refugees, but also of the host communities, I would say. Vulnerable population face specific healthcare challenges, facilitating and expanding access to specialized care that address the individual needs is essential. And again, information needs among refugees evolve alongside the circumstances. And this experience is really witnessing, is really an evidence of the fact that it's all dynamic. So the needs that happened, that were there at the beginning of the crisis, are slowly shifting towards a different dimension as people settle down, as people, find a different occasion of life, education, and so on. And based on the findings I've just showed, many of these findings aligned with the needs of the local population on the long term. So this is a specific need really to address, the needs of the long-term needs of refugees, but also overall to address the needs. It's I would say even a boost to address the needs of the vulnerable Polish populations. I guess this is my very final slide, but another element of beauty of this experience was also to have an inequality lens, really to see what is the differences across different elements between people living in temporary accommodation and people more settled down in, I would say, normal households. Access to healthcare, refugees living in temporary accommodation were more likely to cite barriers of requiring prescription and the high cost of medicine and services when compared to people living in permanent residences. Financial burden, the proportion of refugees spending more than 20% of their income, so out of pocket. In temporary accommodation is twice as much those of living in permanent accommodation. So almost 25% when compared to almost 13%. And finally, again, mental health. Of refugees living in temporary accommodation, almost 20% had mental health problems. And what I mean here, I mean the not complete capacity of running the daily activities because of anxiety, because of the depression, or even post-traumatic disorders. And this is compared to the 10% of refugees living in permanent accommodation. What I'm trying to say here, I'm trying to link this with the diagram I showed you in the third slide about our, world report. So this one that clearly says that the social determinants are to take in deeply in consideration. Temporary, permanent is housing. And this effect of housing is cross-cutting in many different countries of the world. Education, working condition. I guess this was my last one. Thank you so much. And again, congratulations. In Arabic, we say Mabruk. I lived in Jordan for the last 3 years, so sometimes I repeat this kind of words. And it's a pleasure to be here to continue this collaboration. Thank you.
Thank you very much. We still have 5 minutes to our short break, so I would like to ask our participants whether they've got some questions or comments to this part of our conference. Still not. It still will be possible to ask some questions after the next session, so I invite you to think of your reflections. And now I would like to invite you for a short break, and we will meet here 11:15. Thank you. Ladies and gentlemen, it's time to start the next session, which is dedicated to data integration and methodology. So I would like to introduce Professor Marek Cierpiał-Wolan from Statistics Poland. Please, the floor is yours.
So, distinguished guests, what I want to talk about now is why developing a coherent research system for refugees is extremely important nowadays, and I'm going to prove it according to this agenda. And so, I don't want to sound trite, but so the necessary condition for capturing the specificity of refugees is, of course, data integration. Integration of data from different sources, to be exact. The thing is how to do it, how to integrate data from different sources. So creating this coherent research system, all our efforts are aimed at appropriate data integration model. This flowchart presents such a model, so developed together with WHO. And from methodological point of view, the first of our undertaking, as Nino mentioned about it, was not too complicated from, as I said, from methodological point of view, because we conducted the survey mainly in reception points. On the contrary, the second edition was far more, advanced. So this is the reason why this new approach consists of 3 modules. As you can see, survey households, accommodation establishments, and at the borders, the border crossings, to be exact. Of course, each with its own survey frame, sample selection methods, interviewing techniques, etc., etc. So the crucial thing, of course, conducting a survey is preparing a reliable survey frame. In this case, in other words, integrated register of refugees. And integrating data from insurance registers, educational registers, from health registers, etc. We, as I said, selected appropriate data and added 7 registers, completing subsequent data. And applying the duplication methods and using deterministic record linkage methods. We got this needed results. And let me also stress that we chose the border guard register as a master one. So the next step is, of course, to include big data sources. And we considered 2 types of data sources: data from mobile network operators and data from credit cards. Both the president of Statistics Poland and representative of WHO mentioned about it. But so because of the fact that we get data, daily data from T-Mobile, so we use in our estimations, mostly this kind of source. Although we also tried to include some samples from payment card operators. So, of course, there is some problem with full access to this data. Including, of course, X, Y coordinates, and so forth and so on. Mobile network operators usually, maybe not usually, but certainly have this kind of data, but they don't make it available and provide data in aggregate form, which you can see in the table at the bottom. Why? Because of GDPR, because of commercial issue. And so to make matter worse, this concerned mobile network operator, I mean this T-Mobile, defines SIM card as an active in given area if it is active at least 3 hours in this area. It means the possibility of, multiple counting. And therefore, we had to prepare appropriate model, appropriate solutions. Deduplication methods using, as you can see, Markov processes. And estimator of total number of refugees takes also into account MNO's market share. Why? Because we have data only from one MNO. And digital literacy, average SIM cards per card user, etc. So thanks to this, we can provide, or we can track, monitor movement of refugees practically in real time, which you can see here. So let me draw your attention to this slide. It is absolutely our flagship, the background for this, this dashboard. So, the thing is, this kind of undertakings, how to turn the sample surveys conducted occasionally into regular monitoring. So I guess we found a solution. So every quarter, together with National Bank and Ministry of Sport and Tourism, Statistics Poland conducts survey at the borders, including, of course, European Union's external border. And as a result of our collaboration with WHO, we incorporated health model to this system. This allows calibration of data, or to calibrate data, in terms of health every quarter. So from methodological point of view, the thing is how to combine data from high frequency survey with low frequency survey. And on the left, you can see recipe. On the right, visualization, simple visualization. So, and the key issue is that in this case, we used a Bayesian approach. So the last step, the final step, is to attempt to integrate this updated sample surveys with big data. And so at this stage of our research, we use simple shrinkage estimator for this purpose. And in this case, big data or big data reduced some kind of bias. So from outdated integrated register, regarding spatial distribution. So all in all, I can say that taking into consideration this updated sample surveys plus big data, we are able to get real-time, almost real-time picture on health of refugees. So how important is this integration? So it will be shown by Peter in a few minutes. Our president mentioned about it. So during the presentation of dashboard that enables dynamic analysis in a spatial breakdown, almost as I said, in real time. And so let me also stress about this, the specificity and extremely important role of this survey for our integrated register. This, or thanks to this results of our comprehensive system, we can update our integrated register, which means that we have current information on refugees, and which is, extremely important for policy makers. Let's move to the conclusions to be exact. So the first four white bullet points show what we achieved. And equally important is what is ahead of us. Implementation of more advanced methods of data integration and using other sources of data, like data from Google Trends, smart city system, even drones and satellite images come to the fore. We mustn't forget that huge scale of refugees affects not only this health sector, but also different domains like labor market, sense of security, broadly speaking, quality of life or well-being. We discussed yesterday about well-being during our, the day before meeting. And therefore, there is a necessity for developing this multi-method approach with data from multiple sources, in our opinion, still with leading role of comprehensive sample surveys, because we are trying to prepare system applicable also in countries where there is not access to this kind of data. I mean, big data sources and administrative registers. Thank you so much. Thank you for your time.
Thank you very much. Now I would like to ask Mr. Łukasz Sarama from Statistics Poland to present his presentation.
Thank you. Hello again. Just give me a while. I have to find my presentation. Sure. Yeah. Nope. Just yeah. Okay. Yes, it's already success. Another success. Yeah. Yeah. Don't worry. I don't like take too much from your time. My presentation is relatively short. I would like to introduce you our systematic approach. It's another aspect of our system of survey of refugees. We called it monitoring because we will do it quarterly. And let me start by presenting short, main, simple facts, general assumptions of our new approach. Of course, findings and results from systematic approach is very, very useful. So we managed to improve our methodology by adding these aspects. And when it comes to monitoring, of course, it's a simple survey carried out at 4 border crossings located at Polish-Ukrainian border, Korczowa, Medyka, Budomierz and Hrebenne. And the last border crossing is located on the territory of Lubelskie Voivodeship, so statistical office in Lublin is also involved in our undertaking. Participation into this survey is of course voluntary, and we talked with Ukrainian citizens who live in Poland and who declared themselves as refugees. We simply asked if you was in Poland in connection with escalation of the conflict. If yes, please tell us, give us more information. And yeah, and maybe this is the most important thing, that is we managed to utilize the presence of Statistics Poland at Polish-Ukrainian border for over 2 years. Of course, its connection with travels of non-residents to Poland. It's this national-wide survey that we conduct with our partners, with National Bank of Poland and the Ministry of Sport and Tourism. So that was a great occasion for us to add, some model to this survey. As you can see, we conducted not only at external and internal European Union border on the territory of Poland, but also at seaports and airports. But when it comes to our new approach, when it comes to monitoring, we use it for border crossing. This is the photos I try to highlight. Yeah, this is our survey tool. Is our questionnaire. It looks quite complicated, but it's really easy to fill in. And we prepare it into 3 language version. And it's universal enough to be completed by single person as well as, for example, the group of people, for example, family. The main questions, the main sections, you can see on the slide. We try to obtain information about demographic profile of refugees, dates of their arrival, of course, fact of receiving healthcare, what type of healthcare they needed when they were in Poland. Of course, we asked about vaccination, mental health, and so on. This part is a simple comparison between the survey that we finished in 2023 and the first quarter of our monitoring. To be honest, I was wondering if it makes sense to show you the graphs when there is almost no difference, but I thought that is some information because we finished our survey and fourth quarter in December 23. We started monitoring at January, so the time period between these two surveys was relatively short. So in these slides, there are almost no significant differences. For example, here you can see the need for healthcare. Here there is the main need when it comes to health condition of refugees, when it comes to their need of healthcare. And once more, there's almost no differences. And the barriers and cost that they spend for receiving healthcare in Poland, and also from mental health, because it's a question, it's a quite long question, but it concerning mental health. I think that is much better to see it in more dynamic form. So I think that Peter was the right person to do. Thank you so much.
Thank you very much. And the last presentation in this part of the conference from Mr. Piotr Szlachta from Statistics Poland.
Okay, hello. Let me start with a simple answer to one question. Why dashboard? Because preparing reports is hard. And even so, more so if we are about to prepare everyone every quarter. So this is our answer, and I hope you will like it. So the main page of the dashboard is to give you fast and quick information about what is happening with health of refugees. So you have last survey date, refugee population, medical needs, and mental health, as well as 3 charts to show you the population in each survey we did, medical needs, when you can zoom in and see the actual percentages of one period, and health barriers that are concerning refugees. If you want something more, we have these tabs here, but before I move to them, I want to show that we have this also in Polish. So we prepared not only in English, but Polish. And now we can move to the population. Let me switch to English. Okay, here I need to make one disclaimer that is written right here. So the data for population is coming from PESEL register and border guard data. And the nature of sample survey is that we estimate those results, and they shouldn't be treated like an exact point, but more as an estimate. And yeah, this is the look. And what you can actually see, it is all in this one map. where you can hover over some regions in Poland and see how the percentages of refugees looks in each region and the number on the left. But what's most important is you can, for example, turn off males and change age to 80 to 65, for example, and check only those women who declared that will come back to Ukraine after the war. And it automatically updates. But what is even more important for us, that you can actually see the origin from Ukraine when they came from. So for example, 60.7 refugees, women that are declaring that they're going back to Ukraine is from Kiev Oblast. So that's the second tab. The third one, I won't talk much because you already know about it. It's all the results from the report and everything you already saw. So the spending, the COVID, but some of them can be interacted with. And just as the example on the left, there is acute illnesses have a lot more higher percentages. So this might be, the lower ones might be lost. So we can just zoom in and see them closer. And we can just download them to our PC. And now I think our flagship from the new flagship from Statistics Poland, so the data from mobile network operators. I also need to make disclaimer here that we made all the efforts to ensure the accuracy and reliability of the information, but it still should be treated as experimental data only. So what we have here is the first day we got the data from mobile network operators till last Friday. And it's accumulated into monthly intervals. And we can see how the population in each region change. We can switch to weekly and to daily to see other intervals. So for example, we can see that at the beginning of 2024, there was around 193,000 of Ukrainians in Mazowieckie region. But it's not that we can show it only as a time series, but we can show it in spatial disaggregation. So I'm from Podkarpackie, I will choose that. Oh, yeah, something went wrong. Okay, so you can actually see our region, Podkarpackie, and below that you have every powiat that is in that region. And we can do the same thing as within region, just see how the population changed in each powiat. And we can do that for weekly data and see, for example, that in February there was around 6,500 Ukrainians in Rzeszów. And we can even go to daily data and see data from last Tuesday. So when it all comes together is this bulletin, because we know everyone wants some written form of it. So we prepared a simple bulletin to download. You have a couple options here. For example, if you are interested only in health status, mental health, or this experimental data, you can turn it on. You will get information and graph about it, and you can download it to your PC and have it as a PDF. It's the same as on page. Of course, again, Polish version is available also. The last tab is actually us talking about both reports, methodology of the first survey, methodology of the second survey, and who we are. And that is actually all. So thank you, and I would like everyone to visit our dashboard.
Thank you very much. Now we were supposed to listen to the voice from the Ukraine, but unfortunately we couldn't connect to Mr. Ihor Werner, the chair of the State Statistics Service of Ukraine, because of the poor connection. So now I would like to invite you to pose some questions or comments. Both I invite our guests at Statistics Poland and these ones who are joining us on WebEx. So, do you have any reflections or questions that you would like to share? Yes, please.
Thank you very much. And once again, good morning. I'm representing UNHCR country office today. First of all, I would like to convey my appreciation for today's launch event and to see this amazing study and continuous monitoring results, especially the dashboard. I think it gives really comprehensive understanding and analysis on the situation for the refugee populations in Poland. So this is really amazing. So big appreciation from UNHCR side. Maybe 3 points and could be questions also, perhaps to the statistics office colleagues who kindly presented the detailed findings. Maybe first one would be regarding the report that we can actually download from the dashboard. That's really, really nice. I just wanted to clarify whether this report would be specific to the quarterly findings or would they continuously be able to also give an analysis of the previous findings in terms of any changes or not, because that would be very helpful in understanding the changing needs potentially. That would be one. The second one would be, although I see that the data intake does allow for gendered specific understandings, maybe in the report, I do see very specific age disaggregated analysis, age disaggregated findings, but would it be possible to also have maybe an additional layer of understanding in terms of the gendered sensitivities and the gendered differentiation, although I do understand 65% on average of the population are females, but understanding the specific needs of girls, boys, women, men, if needed, potentially also other gender identities, sexual orientations, I think would really help us undertake targeted interventions, I think for all of the different partners taking action, let's say in Poland. And the last one would be, of course, I do understand the focus on the Ukrainian refugees and what we already have here from 2022, 2023, and the continuous regular monitoring on a quarterly basis will have to provide an avenue for comparison. However, would there be any thinking or possibility to consider also including other refugee groups who we have in Poland, as you may know, who have been also here for a long time through a protracted situation, more than 10,000 from different nationalities and countries of asylum. I know it will not give analysis or comparison possibility, but it could be a separate set of data or sample. So those would be the 3 questions in case of there has been any discussions on these or not. But thank you very much once again.
I try to answer. So thank you for excellent questions. From my point of view, it's extremely important for the further collaboration with WHO, maybe not only with WHO, maybe with your organization as well. So you're absolutely right that so it is important to analyze, to take into account, of course, not only Ukrainian refugees, but also another one nationalities. It is possible from technical point of view. So undoubtedly, we should consider this proposal, but I invite you for some kind of detailed discussion, and so I'm sure that we are able to prepare this kind of analysis and this kind of survey, etc. When it comes to this, quarterly survey, I emphasized during my presentation that to some extent, lucky us, having close collaboration with National Bank and the Ministry of Sport and Tourism. And we conduct a survey, as I mentioned, at the borders in households every quarter. So for the BOP needs, balance of payments needs. And it was a perfect occasion to incorporate this health model to this survey. It means that every quarter we will be able to update our results. Plus this daily data from mobile network operators equals real-time, almost real-time analysis. Because as Peter mentioned, we updated this system.
Sorry, could you turn on the microphone because...
We have, 5 days delay, approximately. I'm sorry, it is not real time, almost real time analysis. And so
I have just a follow-up comment, and thank you for raising the third point, which is very valuable, actually. From a global perspective, whenever we go to country as WHO in the health and migration, so not only refugees, we try to highlight the points of the universal health coverage, health security is about all people. So I guess this is a very innovative approach, what was done in Poland. It could be a very good entry point to apply the same for other vulnerable population, which are in this case refugees of other nationalities, as well as migrants, like students, like migrant workers, and so on. And now I would like to go back to the beauty of this initiative, which is really about governance. So bringing together different data sources. This is the critical point, because of course, depending on the migrant typology, you have a different ministry that might have a different data source. So you have a Minister of Interior, Minister of Foreign Affairs, Labor, and so on. So the key here is that how to learn from this experience on how to negotiate, on how to bring around the table the right stakeholders with the right data sources, and to start working together in linking these different data sources for policy making at the end of the day. So I guess in short, what I'm trying to say is that I guess these show the flexibility and how using this methodology can be applicable for other vulnerable population. Thank you.
Can I add something? Of course, that your questions were very right to the point. And one thing that we want to communicate here today is that we have developed capacity to really tackle those issues in a very innovative way. And to some degree, we want to sell it also to the outside world. And that includes also international organizations. And when I think of all of those international organizations having those humongous budgets, I think that there is a right point in time now to also kind of like share a little bit of those money and try to finance the surveys that we are presenting to you today, because that's not only on the, it should not only be on the burden of the country, on the host country, but also if we're aiming at the same objectives, and those objectives are in line with the with the missions of those international organizations, there's always a chance that we can, come together and do those things. And now we're today presenting the capacity to do the things that no one else is able to do. And it's thanks to our unique position in the information system that we can integrate different data sources that no one else can integrate for many reasons, including GDPR, for example, to start with the biggest obstacle. And we provide you with this fantastic opportunity, and we're of course waiting for the offers, because at the end of the day, it's always, I'm sorry to say that, about the budget. The sky is the limit, so is the budget, always. Thank you.
Thank you very much. Are there any questions more from the guests here? Thank you. We've got a question from our participant joining us on the WebEx. Why the online continuous monitoring is so important in this case? This is the question.
Okay, so this is one of the questions that we very often discuss in the forums of, chief statisticians, wherever, because we have nothing in detail to discuss, and we discuss those generic and very high-level problems. Timeliness is always an issue in official statistics. Someone mentioned, Nina mentioned it today, that when you execute a regular survey, it takes you like 12 to 24 months to compile the results. And then when we can kind of integrate new data sources and kind of blend the different data sources in a mix that allows us to produce nearly real-time data, it's something that is unprecedented and before, especially in the areas like those. We can use very sophisticated sampling techniques and some tricky statistical methodologies to come up with the data that is almost in real time. And of course, it is not in regard to every single characteristic that is of interest for ours, but at least to those main categories, we can update the information, which is important from the point of view of analyzing that particular population. It's hard to reach population for many reasons, but mostly also for the extent to which this mobile population and just moves very quickly across the country. And then when it moves so quickly, it's very hard to reach it and to actually, execute any survey among that. And then when we blend in those different data sources, and we are still, even though able to kind of monitor the movements, then we can see in terms of the health issues, how those movements can impact the situation of the refugees and the hosting population as well, which is incredibly important. So I think that there is no better fight in the world of official statistics than the fight for the timeliness. And we're kind of winning it with this example. Thank you.
Thank you very much.
If I had answer with one sentence, this question. So the results of this survey are extremely important for policymakers on not only for national level, local, regional level. And so it is the key issue from our point of view, preparing this spatial breakdown of this analysis. Thank you.
Thank you very much. I would like to ask our participants online if you want to share your reflections or questions, you can just raise your hand at WebEx. So I think we do not have any more voices, so I'm pleased to invite you to a break. We started a bit earlier than it was supposed to be. So I'm not sure whether the lunch is ready, actually. But the next session, we are starting at 1:30. We can start earlier. Okay, so I think we should do a break for 1 hour. So please be here 1:10. Thank you.
No, I guess at 1. Yes, we start at 1 or 1:30. How do
We
you-
were supposed to start 1:30.
And we start like that and we keep it earlier, just maybe at 1
Yes,
o'clock.
earlier.
Let's start 1 o'clock for those of you
Yes,
who are
I think-
following us online. 1 o'clock, we're coming back 1 o'clock. Thank you.
Dear guests, we are about to start the high-level panel, but before we start, I am pleased to announce that although Mr. Ihor Werner, the chair of Statistics Service in Ukraine, couldn't join us in person, he sent us some words, and I would like to read the letter from him. Dear Chair, dear participants, I really appreciate to take part in such an important event. Thank you very much for inviting me. Allow me to express my gratitude to WHO and Statistics Poland for the development and implementation of such an important project, the results of which make it possible to estimate the number of Ukrainian refugees in Poland and their main social demographic characteristics, which is very important both for Poland and Ukraine and the international community as well. According to the results of the project, we received information about the level of satisfaction of Ukrainians who, as a result of the aggression of the Russian Federation, were forced to leave their native homes and seek salvation in the territory of Poland, with the medical service provided by them by the government of Poland, which is financed in particular by international organizations, including WHO. According to this information, about 3 per 4 of Ukrainian refugees in Poland have a very positive level of satisfaction of medical care they are receiving in Poland. The conditions in which they live as well. In this regard, let me express special thanks to the Ministry of Health of Poland and Statistics Poland, which timely provides important information to the government of Poland regarding the locations of Ukrainian refugees and the problems they faced. Let me also many thanks to a group of Ukrainian scientists under the leadership of Professor Igor Mantsurov that also took part in the implementation of the project. This allows the government of Ukraine to accurately estimate the total number of refugees abroad. And in the end, I would like to say that the government of Ukraine hopes to implement a similar project in Ukraine under the WHO umbrella, in which the target group of about 3.5 million IDPs who were forced to leave their places of residence and currently live in various regions of Ukraine will be assessed. The implementation of such a project will contribute to the world community's understanding of the level of tragedy of what is happening in Ukraine and the provision of urgent humanitarian, in particular medical aid, to these vulnerable population groups. Thank you very much for your attention. Ihor Werner. Now we can start our high-level panel. And let me introduce our distinguished panelists. Dr. Dominik Rozkrut from Statistics Poland, Dr. Michał Dzięgielewski, the director at the Department of Healthcare at Ministry of Health, who is joining us online, Mr. Marek Kolano, the Data-Driven Solution Director at MasterCard, and Mr. Adam Głąb, Master and Advisors Director at MasterCard as well. The panel will be moderated by Mrs. Paloma Gucci from the WHO, who is connected with us online. Do we have the connection? I would like to check.
Good morning. Good afternoon.
Thank you. Paloma, the floor is yours and the panelists.
Thank you very much. I don't know if please the camera can focus on the panelists. That will be really appreciated.
Maybe if I say something? Yes.
Fantastic. Thank you. Good afternoon. My name is Paloma Cucci, and I work for WHO. I'm the former WHO representative in Poland, and I had the pleasure and the honor to spend 5 years in wonderful Poland, as well to have the pleasure to work with Statistic Poland, starting on this project that now very brilliantly Nino is really taking to the top. So, distinguished panelists, it's a pleasure for me to be here. And the format of the panel is that we will be asking questions to the different panelists. The idea is to have about 2 questions for each of you. And and enjoy the session and inform more to the panelists. The first question is for Mr. Roskrut, and you know that as you were describing this morning, we are seeing an exemplary collaboration of health and statistics, and there is always been talk about how we need to strengthen this collaboration. But you have shown a clear example of the advantages and the benefits of both of them working together. You have also, Gus, Statistic Poland has also shown an example of integration of how different data sources, including big data, can be used. So I think this is one of the a few examples that we have of this kind of integration. So my question to you is, well, in a nutshell, what is this the new gold standard? Is this the way we should aim to the future? Has Statistic Poland through this work paved the way to be this the gold standard of collaboration and of model to work? Thank you. Back to you.
Thank you very much for this question. I actually very much enjoy what you've asked me for. Because I think it's our DNA. I mean, our statistical offices around the world to provide the society with necessary information to take informed decisions. And when we think about that responsibly, of course, there are many ways in which we can pursue this objective. And of course, one of the ways is just going into a very close collaborations with the other partners so that we can extend the range of statistics that we are able to produce throughout those collaborations and, for example, improve the quality, timeliness, accuracy, granularity, all those aspects that are extremely important in terms of the policy making, in terms of especially in just providing a very deep insight into subjects that really count. And of course, you're right that there has been a lot of discussions in the past in terms of like how we should collaborate, and nothing really concrete came out of it. But we're trying to think of that differently. We have a strong will to actually deliver, and if you have this will, and then you find those collaborations as very useful and effective ways of actually providing what you want to provide. And that's the whole explanation. I mean, we take our role seriously and responsibly, and we do find a lot of value in establishing partnerships with the external partners. Let it be like private sector partners that we have managed to collaborate very successfully here, and thanks to our colleagues from MasterCard and also from T-Mobile, which are not in the room now at the moment, but at the same time with our national partners like Ministry of Health, and then on top of that with the international partners like WHO. I think it's extremely important, and indeed there are not many cases in which this collaboration goes that deep and that successfully, and I say about the global level, even at the global level, but I think that's the way to go. And I think it has always been the way. It was just lack of will, maybe, or something else. I don't know. I just want to delve into it. But what want to tell you is that currently at the moment we're coming up with a new idea. Some of my colleagues says that the role of statistical offices is changing, and they came up with a brand new marketing names for what we do. They try to call it data stewardship, and we're data stewards, and the data stewards is just something more than solely producing statistics. It's not only disseminating, but also collaborating, facilitating, things like that. I think to myself, if you ask yourself, truly the same question and turn back 20 years ago, I wouldn't claim that the colleagues that have been working here 20 years ago were anyhow different from us. They've been kind of like trying to do exactly the same things. Maybe the language is changing, but on the side of statistics and statistical systems, there has always been a lot of people that feel responsibility for delivering very important information. And just to conclude that, I just wanted to point out to one very important aspect of all of that. And I think that is what brings a lot of advantage to this project, thanks to the fact that the statistical office is part of it. We are at the specific, very peculiar point in the information system in which only us statistics office are allowed to integrate data at a very granular level coming from different sources. Because according to the current data governance systems, established after first implementation of, let's say, for example, GDPR, there are many limitations in which you can process data, especially individual data. And but it turns out that for statistical purposes, we have this kind of a derogation in our legislation systems that we can integrate different data sources. No one else can go with the integration so deeply as we are. So even though there are projects outside of statistical systems also around the world that try to mimic what we're doing here, they will never be so successful if they do not take a statistical office into the set of collaborators. And I think that's pretty a big advantage of our project. And of course, I don't need to mention that, of course, from the sustainability of point of view, how we can sustain, there's no other organization that can kind of guarantee that we'll continue doing those things for long. Thank you.
Thank you. No, I totally agree. I've been part of this project from day one, and I have seen firsthand how this collaboration has really enhanced the project and take it to a different level. Thank you very much. The next question is to Dr. Nino Berzulli. And what I would like to ask you is from the public health perspective, what are the takeaways for you for this report and insights on what is next? Thank you.
Thank you so much. And Paloma, first of all, I would like to thank you for initiating this project from the very beginning, and the excellent work that was done by you, and this collaboration that was born when you were here as the WHO representative. So really big thanks to you. And as Dominic said, I think it's a power of the partnership. It's really striking example how the statistics and health comes together, and we have to rely more and more these types of the partnerships, these types of the collaboration in order to be able to truly produce the data for the public health decision making. And what Dominique said about the granularity, access to the granular data that we need to have at our hands to be able to really understand the inequities at the local level, it's very important to have it, not just the aggregated data in the national level, but really going down to the local levels, to the community level. So that's the beauty of the collaboration when the health and statistics come together. And of course, our partners and the colleagues from the private sector, it's a very good example of the public-private partnership, and the MasterCard coming to this initiative, to this collaboration, bringing this granular data on the out-of-pocket expenditures, for the most vulnerable groups. Of course, this data is produced by the health sectors, through the household surveys, etc. But again, it's the real-time data that we can have with a little time lag to understand specific challenges of the vulnerable populations, such as Ukrainian refugees. But this work can be further expanded to nationally and globally also, and have this granular data in terms of the financial protection of the vulnerable populations, refugees, migrants, but also the host population. So thank you so much for this excellent collaboration. In terms of the question that you asked me about the takeaways, my main takeaways from the public health perspective, my colleague already presented in detail the findings from this research from 2023 survey comparing with the data from 2022. And there are many valuable takeaways from this research, from this report. And of course, I would encourage you to read the report because it provides really granular data. But maybe a few takeaways. First of all, the refugees are not the monolith. We see the diversity in the population. Some navigate the Polish healthcare system well, and we do see from the research that the understanding of the Polish healthcare system has increased in comparison with 22, but there are still the groups among the refugees that are having the difficulties primarily because of the language issues, the cultural barriers, and this is particularly prominent among the older refugees. So truly one-size-fits-all approach will not work. We always need to have this understanding, the granular, for which we need to have the granular data to be able to really develop the contextual solutions and the targeted solutions for these vulnerable groups. The second takeaway is the progress that is being made, and we do see really increase access to healthcare services for the refugees. We see the children, receiving the vaccinations. We see the Ukrainian refugees accessing the healthcare services, obtaining the disability certificates. We see Ukrainian healthcare providers who are getting integrated into the Polish healthcare system, obtaining their certificates for public practicing. We see the satisfaction from the Ukrainian refugees, as I already mentioned, in terms of the healthcare they receive in Poland, citing the empathy from the healthcare providers, citing the quality of care that they receive from the Polish healthcare workers. And of course, this is a testament of the efforts of Poland, many stakeholders, primarily the healthcare providers, and in general, the Polish population that was so generous, opening the doors and providing the benefits also to the Ukrainian refugees, same as the Polish citizens. But of course, there is more to be done, and the report showed that there are some inequalities, there are some barriers to care. And as we already pointed out, these barriers include the long waiting times to see the specialists. This is also related to some of the services related to the mental health, to seeing the mental health specialists, which we already know that it has been problematic also, or the challenge for the Polish citizens as well. So really this conflict, this crisis, of Ukrainian refugee crisis, not only in Poland, but in all refugee hosting countries, highlighted the weaknesses of the healthcare systems. Some of the important system strengthening needs that still need to take place. But of course, every challenge, every emergency, every crisis is an opportunity to transform. And that's, what we see in Poland in terms of the transformation of the mental health system, for example, really bringing the services closer to the community level. 50% of Poland is already covered by the community mental health center. So this is really great achievements. Inequality. So this was one of the aspects that we also touched briefly scratched the surface in the report in our research by comparing the refugees in the temporary accommodations and the permanent with the permanent residents, and we see the disparities, particularly among the refugees that are in the temporary accommodations. They often face the barriers, the greater barriers, accessing the care, and this is particularly prominent, as I mentioned already, among the older refugees, more than 65 years old, who are having the difficulties in terms of the learning the language, in terms of better understanding how to navigate the healthcare systems, using the technologies, the web and the mobile applications, because most of the information is through the web, through the different platforms, and they are having the difficulties to accessing those. So I think these are sort of, the major takeaways from the research, from our studies. There is a lot that has been already done, but there is also still a lot that needs to be done, and this can be done only through the collaborative and the coordinated effort of many stakeholders: the government, the civil society organizations, the academia, the international organizations. So this is, as I said in my opening, health must remain a top priority in the emergency response.
Thank you, Nino. I also will take my takeaway, and I really like your approach, thinking about the possibilities and the transformation of this information and of the health system for all, not just for the refugees, but also for the host population. So thank you for that. And my next question is for Mastercard, for Mr. Colano, Mr. Adam Glab. And I think there is a question in the mind of everybody. First, I want to thank you for the contribution, for the immense contribution of the data for this data integration. But I would like to know how this started. What is behind? I mean, what was their thinking of collaborating with this and supporting the humanitarian response effort in this way? I think it will be interesting to know of this partnership. Thank you. Please, you decide who wants to take the question.
That might be me. Thank you. So it's not a surprise that the public sector in its entirety is an important partner for us, because we live in between regulations and in general some other form of telling us what and how to do stuff. But I represent Adam is advisor, but I represent more analytical part of our company, and we as an analyst, maybe you as statisticians as well, too often associated with people overly attracted to the mathematics behind the analysis, but we are still some kind of humans that would like to see not only the complex problem being solved and implemented in the code, but some people making also a decision, maybe data-driven decision at some point. And also, we are aware that we are part of the healthcare system. We are aware that we are citizens. So maybe we realize at some point that we can be a part of this decision-making process, and we start to treat this cooperation between our companies and entities pretty seriously. So yeah, we really like to see our statistics being employed into the decision-making process and the policy-making process. At the same time, we are a commercial company, and we can afford some kind of exchange, which is mutual and fair exchange. So whenever you gain knowledge from our ecosystem, we gain knowledge from your ecosystem, and we make our, I would call them commercial analytics, slightly better. So I truly believe that this is win-win situation. Also, we, as a payment ecosystem, as a cards in general, we became relevant many years ago, and right now we feel that our transactional trends really correlates with actual statistics that you publish, right? So we can at least model the correlations between, and maybe use one or two as an additional data source. And we are also not overly excited with our data. We know its value, but we know that this is part of the ecosystem. We need traffic data, we need payment data that overlap in some ways, in some use cases, but not entirely. So there is part of the story that traffic data doesn't tell, and there is a part of the story that infrastructure or payment data doesn't tell. So we believe that multi-dimensional analysis is the way to go, simply, and the relevancy is here. And I think we are also in the safe environment because we have a reputation to protect. We have the safety of the transactions and the analytics to protect. And I think you are good entity, both Central Statistical Office and WHO, that we can trust that we will follow mutual agreements, mutual ways of protecting our data from even fair mistakes, right? So we have a lot. Maybe sometimes we are overly confidential, maybe sometimes we are overly protective, but still it serves some greater value. So I would say the relevancy of the decision, the mutuality of this, and the trustfulness of each partner in this ecosystem brings us together. And every time we have a chance to influence and ease someone's decision-making process, like in refugees, we try to use our competences, which is data. We don't know anything else. Thank you.
Thank you very much. So I would like to add that we also have an example of a public and partnership, which is always very important. And this project showcase how the power of this partnership and to continue it. Now I would like to address the Ministry of Health. We have Dr. Michał Jędrzejewski online, and well, my question to him is, I can imagine the ministry to be in the shoes of the Ministry of Health when the crisis in Ukraine started to happen, when the war started, and you saw thousands, millions of people crossing the border to Poland. And I would like to take you there at that time, and if you can share with us at that point, I can imagine that you were desperately looking for data to plan, to strategize, to really provide support, and especially health support to all these refugees that were coming to Poland. So can you share with us at that point, which kind of data would have been more useful for you to have? Because I think this is one of the situations that many of the stakeholders in the response were feeling, the lack of data, how to better respond to the health needs. Thank you. Back to you. I don't see you, but I know that you are connected.
Okay, I'm connected. Yeah. Thank you for this question. It will not be ironic, but I can say that we managed to make health system working properly for people refugees from Ukraine. Of course, no one is prepared. Of course, always the war is unexpected, so it's not very easy to start it. We make two things which help us to make it. First of all, we have given all the rights by legal acts to access to health system in Poland on the same rules as every citizen from Poland. So there was no need for making a special health service for people from Ukraine, no special medical facilities for them. They just used all the same in the health system as citizens from Poland. The second thing we have done, it was common access to registration refugees from Ukraine and to give them something which is called ID number. It's special in Poland. So we can monitor all the medical advices, all drugs, all hospitalizations, everything which has been done to refugees, and there was a special fund to pay medical facilities for it. So there was no barrier in material sense of access to medical services from refugees. Of course, they have been all over Poland, in every place, even in small villages. Everyone knows that they can safely give medical services to refugees from Ukraine. There were, of course, some problems with drugs refundation and in medical documentation, because it was a real barrier in refundation of drugs in Poland. But I think that we have managed to do it in the first days of war. Thank you.
Thank you. Yeah, we hear you.
Okay, that's all. Thank you.
Thank you. Yes, I know it was really an impressive response for Poland from all, from you, from the population, for everybody. And I can imagine the situation trying to respond, especially at the beginning, when we were all playing without really knowing what was happening. So congratulations and thank you for the support of Poland. My next question is also to Mr. Roskrut, to Dominique, and I want to ask you, I know that you mentioned during your speech the presentation at the UN Statistical Commission and the interest of in both sessions 54 and 55. I know that you have the 4th Congress of Policy Statisticians coming up to Warsaw in July. And I wanted to ask you, okay, what is the results of today that have been presented? What is the response for the international community? What is the appetite to continue working on this methodology and taking it further to apply in other countries and to keep it grow, in other countries receiving refugees or even beyond the refugees, migrant population to other populations? Thank you. To you.
Thank you for this question. Actually, there was a couple of years ago, when the term big data hit official statistics, and we had a lot of discussions internationally, including globally, in terms of how to tackle those new sources within the official statistics production processes. And then it transferred and moved towards more general discussion about the new data sources at large. And of course, the big actor came into play right away. It was a new privately held data sources as well. And we've been discussing those issues for long, as we have seen collectively a lot of opportunities and a big playground for innovation in terms of official statistics. So we've been all for years, for decades, trying to improve timeliness, granularity, accuracy of our results, and provide even more insight into what happens around us. But yet we had to wait until that time when the big chance came, and of course we don't want to spoil it. But one thing is talking, and we, of course, in a public sector, everybody likes talking, and the actual doing is much harder. And of course, to some degree, even internationally, we compete in terms of the speed of integration of those new sources and those new tools and methods that are necessary to process them into regular processes of production. I remember myself being engaged very officially, though not as a representative of Statistics Poland, but in my personal capacity to be part of the expert group by the European Commission on facilitating the use of privately held data. We've been working together at the European Commission level for 2 years, preparing some reports that really influenced and informed decision-making and that was leading to introduction of all this new data governance-related legislation in the European Union, like a Data Act or Data Governance Act, when we've been foreseeing that there's going to be a need to justify and to facilitate the use of privately held data. But of course, it comes at the same time with the need for improve our internal capacity to process big data sources at large. And so we were trying to develop those skills also in parallel. And that leads us to today. And what we are presenting here, from my perspective, is, of course, it's an extremely important topic. Just to say it very clearly, health of refugees currently in the situation that we have in Poland is an extremely important topic. Health is, all of those are important topics. But at the end of the day, of course, we are professional statisticians, and what we do care is about our capacity, our ability to process a whole range of different data sources in an effective and efficient way, and to produce more and more insight. And of course, we're very happy that at the core of this project is something that I would call, borrowing from the naming frame of the gaming industry, I would call it an engine of what we're presenting here. An engine is our internal capacity to integrate administrative data, survey data, privately held data, and come up with the results that we come up. Because what I think about it is that we can quickly reapply this engine in other domains of our statistical production. And indeed, that's what we do. We do that in transportation, for example, that we also produce somehow similar system dashboard that allows for nearly real-time observation of what happens in terms of the transportation in Poland. And there are many other domains in which we can reapply those methods, again, taking advantage of the capacity to have the very successful partnerships with the private sector. I don't want to overstress it, but that's very important that we have our partners here along the table, because I completely share their view that that we should shape this collaboration in the form of a win-win situation. And actually, if we want to do it responsibly, there's no other way, because really we can win. Our partners that are here today with us share exactly the same values. I mean, the trust, confidentiality, privacy, cybersecurity. We're very well known. Both systems are very well known for really taking care of the data that we process. But at the same time, if we combine our capacities and our sources, then we can jointly produce a much bigger value added out of this combined blended data sets that if we would be compared to the situation when we wouldn't be able to merge those. So I think it's a very generous situation and very generous times for statisticians, and that's why we're looking in a very positive way about the future of what's coming based on the results of this particular project and how it can be expanded towards these different domains.
Thank you. Thank you. Really, what you describe really paves the way to expand for health, but also to other dimensions. And Nino mentioned inequalities, well-being, but even going beyond health to other aspects to really have a comprehensive view. So thank you for that. My next question is to Dr. Versuli. And I would like to explore with you, you mentioned mental health, and the mental health needs of the refugees have been mentioned several times during the meeting, showing how important this topic is. So please, can you reflect about what we have heard, these concerns about mental health and the strategies about, how to tackle this awareness, this lack, to increase awareness and reduce the stigma in general about this situation. Thank you, please.
Thank you, Paloma. Yes, as we know and heard from the presentation, that mental health is one of the needs, the important needs, the critical needs of the refugees. Although what I want to highlight, and I think Saberia also mentioned in his presentation, that the real need may be underestimated for mental health because of the various reasons, including the cultural reasons and understanding or recognizing the mental health challenge, mental health issues. And we do see also some inequalities in terms of the mental health and the well-being reported between the Ukrainian refugees that live in the temporary accommodation versus the permanent residents. We see the needs, the increased mental health needs among the children and the adolescents that was clearly showed by the report. What I want to also mention that the mental health is the biggest challenge everywhere globally. Even before the COVID-19 pandemic, mental health was one of the most important and the critical issues, and WHO actually prioritized the mental health as the flagship initiative, flagship project in the European region. And when this crisis happens, when there is an emergency, of course, the mental health worsens. And we do have the data showing that after COVID-19 pandemic, mental health challenges, further exacerbated. We do have the data from our big survey that the WHO runs, health of the school-age children, health and the behavior of the school-age children, that actually showed across the European region worsening of the mental health conditions of children and the young people. So the challenge is big, and of course, as I mentioned, the crisis worsens, exacerbates this situation. WHO has been working in partnership with the Ministry of Health, in partnership with our health partners in Poland, with the civil society organizations, with the local grassroots organizations, to really bring evidence-based tools. The WHO has very interesting and evidence-informed, evidence-based tools that can be used by non-professionals. We call it scalable interventions that can be used by anyone who is trained, but does not require the specialist or the medical provider, so that these effective tools can be used by everyone to provide the mental health and the psychosocial support to Ukrainian refugees, but also to the host communities, to the Polish population. And we are very glad and we are very happy to see that this tool has been used, these different tools, and I'm referring here self-help, problem management, plus tools. These are the WHO's tools. They've been increasingly used by the different stakeholders, the local organizations, the NGOs, to support the Ukrainian refugees at the grassroots level. We do work also with medical establishment, education establishment, so that these tools actually are integrated into the medical education system, because they are beneficial not only for the Ukrainian refugees, but to everybody. And we know that the waiting times to see the mental health specialist is long, in Poland and many countries in the European region. But not all mental health conditions require specialist consultation and the specialist care. So more than 80%, can be managed, with the simple tools, that don't require specialist consultation, and can be managed also at the primary health care. And here we do work with the Ministry of Health to scale up the integration of mental health gap action tools into the primary health care. So that this is also the WHO's tool, which allows the primary health care provider to recognize the signs and the symptoms of the mental health conditions and provide support. And in case of the specialist support, provide adequate and the timely referral to the specialist. So these are the type of the interventions that the WHO, together with the Ministry of Health and the health partners, have been doing to really fill this gap in terms of the need of the mental health services, which benefits both the Ukrainian refugee populations, but also the Polish population. 2 weeks ago, we had a very interesting forum, the National Mental Health Forum, that brought the different sectors, the Ministry of Education, Ministry of Justice, of course, together with the Ministry of Health, the WHO organized this forum, as well as all the international organizations, academia, and importantly, the professional community, mental health professional community, the primary healthcare providers, to discuss how to move forward with scaling up important reforms and the interventions that the Ministry of Health has been doing, which require intersectoral governance, which require intersectoral work, because the challenges that the kids, for example, are facing and mental health cannot be only tackled by the health sector alone. It requires the education sector to be on board. And there are many interesting developments and important developments that the Ministry of Education is implementing in terms of increasing access to the mental health counseling and the services in schools. So it's when I mentioned that in my first intervention, that the crisis actually highlights gaps in the system, but it is an opportunity, and we see this opportunity to drive and to move forward with the change, important transformation in the system, and this is what we see happening in Poland in terms of the mental health. Thank you.
Thank you, Nino. I think it's very important, the 2 points. One of the two points that I want to highlight, one is that the big problem that mental health is in many societies today, but also the opportunities of the actions that are happening to tackle this situation, and the different ways that it can be done, no? And they need to work together for really to tackle the mental health problem and make populations better. Okay, my next question will be again to Mastercard. And I wanted to ask another question that I think is also in everybody's mind, and that's about the privacy and the ethic consideration. We are in a society that we are talking about cyber attacks, data privacy. So I wanted to ask about from you, what is the ethics and privacy softwares that Mastercard prioritizes when sharing and analyzing sensitive data? No, that we are working for this project or for other projects. I'm sure that you have all the safeguards there, and I would like if you can share with us. Thank you.
Thank you for that question. As Mr. President already said, we are famous for security, and this security is usually associated with the transaction happening behind the payment ecosystem, right? But whenever the transaction happens, some information is collected, and I would maybe start with some explanation and maybe some myth busting regarding what data we even possess, because let me start straightforward, because sometimes also as an analyst, maybe not statistician, but as an analyst, we live in this, sorry for this phrasing, schizophrenic approach. So as an analyst, we want more and more data, but as a data producers, as account holders, as a payment ecosystem members, we don't want to share overly the data, right? So every time now, from now on, whenever you will use your Mastercard data, please be ensured that first of all, we at the very beginning even don't know your first name, last name, age, gender, and so on. In our ecosystem, we are only fed with information about card number that for analytical purposes is immediately transferred to the hashed PAN. It's not physical PAN anymore. And this is, I would say, the personalization of the transaction that happens at the background. But from the GDPR perspective, it's not. It's still personal information. It's not personally identifiable, but it's personal information. So we proceed to the step number 2, which is some kind of anonymization. And anonymization can be done on various different ways. The difference is computational complexity and how much information we are losing during the anonymization. And for our cooperation, we selected probably the safest, which is aggregation. Because once you aggregate some data, you lose a lot of information that can be used to revert that process. You will have to have a lot of information that typically you don't possess to revert the aggregation process. And the more entities you have in this micro aggregate, the safer it is. So even if we are after simple statistics like how much people spend on groceries every month, right? This can be pretty well aggregated, but you can answer with this also more complex questions, because we can even anonymize the sequence of the purchase. As long as many people, as long as many cards display some transaction patterns, we can still use, and I believe in the literature is called trajectory anonymization, something like that. It's fairly known way of anonymizing even complex behaviors. And I believe we are also sharing very similar approach, because you also need to anonymize at least two members of the picture. First member is an individual person, like card holder for us. You cannot share the individual people information, same for us, but also the entities like merchants, like issuers, like banks. We have the same rules for that kind of entities. So like I said, at the very beginning, we are getting rid of the very sensitive information. We are passing by the transactional information, then it's being anonymized. And this way we are getting robust and ready to share with also not everyone, but some only esteemed entities, the information. And don't get me wrong, I mean, I already said and stressed that we are losing some information, but we proved with the merchant analytics, issuer analytics, public sector analytics, that even segment to segment matching, some probabilistic matching, which is more protective for our goal here, is good enough to recreate some of the decision-making process, to recreate some of the patterns that are underlying in the phenomenon that we would like to understand, especially when it comes to the spending on the healthcare system, because it has another status than typically your spending data, right? So spending in the health-related categories have a different layer. And last but not least, we understand each other deeply, and we both mutually respect our I would call it, I don't know, approach, boundaries to the responsible machine learning, to the responsible algorithm testing. And we know that if we will share some data with you, right? If we will proceed with some machine learning behind to discover some patterns, and if we will, let's say, discover that the model is biased, or is not reaching some accuracy that we are comfortable with, we can stop this immediately. We don't need to pursue because we signed something and we need to prove to our, I don't know, stakeholders or to whomever that we are very agile and next year we will launch something. So we feel safe with your similar approach to our privacy. In our data, we are getting rid of any information that is not extremely necessary to do the job, and then we follow few-step model to ensure that this privacy by design takes place. Thank you.
Thank you very much. You respond to a question that I always wanted to ask, and now I have the opportunity. But also, thank you for addressing the biases. I think that's a very important topic too, to ensure that the data really that you have provides the accurate information for action. My next question is again to the Ministry of Health, to Dr. Michał Jędrzejewski. And, you know, the Ministry of Health, given that the Ministry of Health very proactively has been ensuring the long-term access and the well-being of the refugees in Poland, what is your takeaways from the information that you hear today? And based on the experience of this partnership and collaboration, how do you see the partnership with Statistical Poland, with WHO, with MasterCard, you know, growing into capitalize on this wealth of data and information to continue working together? Thank you. The floor is yours.
A very interesting question. To tell you the truth, it's not the question of chronic diseases in Polish conditions or in the things what we have seen. There are some special conditions which we look for. Vaccination. Population coming to us from Ukraine was poorly vaccinated, and it was a great problem to force people to vaccinate kids in proper age. The second thing was the great wave of contagious diseases like tuberculosis and immunodeficiency syndrome. There is a great percentage of people in Ukraine suffering from these diseases. We've got special programs with the help of WHO to give these people proper drugs for all these diseases and to treat them properly in our facilities. Diseases like cardiovascular, like oncology, wasn't very bad in our condition because, as I told, we haven't given the special medical service for these people. They were just in our hospitals, and population between 18 and 60%, it was just about 1% more than people living in Poland. And we have spent even less money because they were rather healthy. Talking about oncology, there was some special kind of it during the first days of war in Ukraine. Different universities specialized in children oncology have taken nearly all the kids from Ukraine to hospitals in the first wave, all in Poland, and with the help of friends of different countries from European Union, they all were treated all over the Europe, not in Ukraine, because we know it was a great effort for Ukrainian towns, especially bombed during the war, to treat them properly. So this was rather more identified field of effort than common chronic diseases in Polish conditions. I said it was the same kind of medical help. And of course, there were some problems in different approach to drug recommendation. For example, in Ukraine, antibiotics are without prescription. In Poland, there are prescriptions. Such as small places where our systems of healthcare differs from Ukraine. So it was rather this field than chronic diseases. Thank you.
Fantastic. We all know about the efforts and the report distillate how the appreciation for the care and that the refugees have been providing. And so thank you for your response. And the next, before I would like to see if there is any question from the audience, either online or in the in-person audience. If anyone has a question to our distinguished panel. Okay. I know it's getting late and everybody's tired after the nice lunch. So then I will like to, for the closing, what I would like is, hold on. Let's give a few minutes, a few seconds. I think maybe there is some questions online. I think this is a very interesting discussion that takes us really to show all the work and all the faces and partners that are together. Hold on a second, I see. Anyway, well, if there is any question, we will pick it up. What I wanted from you is if you can give us a statement, final words, thinking of the future. Where do you see this relationship and this work going? So if you can give us your, in a sentence, in a few, just, I obviously continue working, but just what is your last words before we close the event? Maybe we should start again with Mr. Rochuk, with Dominique, please go ahead. Just your last words before to close the panel.
I just wonder what to say. I mean, we're quite happy about the outcomes of this project so far. We've been, as discussed, doing this together with WHO for 2 years already, and throughout this process, we have learned a lot in terms of health issues, health of refugees issues, but last but not least, we have developed a state-of-the-art technology, I would call it, to integrate and blend different data sources. And on top of that, we have managed to also establish very successful collaboration, not only in between the usual suspects, like public sector bodies like WHO at the international level, Ministry of Health at the national level, but also with the private sector companies, which are really aware of also those higher societal goals that we all face and that are willing to collaborate with the public sector to deliver the public value that is important for current policy making and to make our lives better and not to leave anyone behind, as the well-known motto of the UN says. We're very glad that we're part of that, and I would like to take this opportunity to deeply thank all those partners. And Nino represents WHO, with the colleagues, with the Saviero today. Thank you not only for the fantastic presentations, but also for this continued support. Of course, to our partners with private sector, MasterCard, T-Mobile, and others who will be joining these and other efforts in the coming months and years. And of course, to everybody in our organization involved in that, especially to our regional office in Rzeszów, Marek Cierpiał-Wolan, our dear colleagues who are presenting together today this beautiful dashboard that is available online. I would like to encourage everyone to go online and check the dashboard. And really, it's not the presentation. It really works, and it contains already the data that are daily data from the most recent days. So that's really an example of a big achievement that is not common among even the top statistical offices in the world. So we're very happy. And this is the moment of quite a satisfaction, I would like to say. Thank you.
Thank you very much. I see, all of you have shown that there is much to be done, that there is a very exciting road in front of us, and with infinite possibilities to grow and take this work even further, not just here in Poland, but grow to other sectors and other populations. And if any of the panelists would like to say a last word before we pass to the next section, if not,
just quickly want to echo what Dominic said, and on behalf of the WHO, once again, really would like to thank you and your leadership in this partnership. Of course, in our private sector partners, it's really win-win partnership, and the data that has become now available, the dashboard, it will be really, really handy for the policymakers, public health decision makers, to be able to really use it for the policies, for developing and for implementing the responses and the monitoring the health of the refugees and their access to the healthcare. So we're really very proud of this collaboration. And of course, as many times have been already said, we would like to take this partnership further and expand this to the new frontiers, explore the new frontiers. And yesterday we were discussing with the colleagues, with Marek, and of course, with the Krakow office, how do we join the forces in new areas and in the innovative areas of the well-being economy. So we look forward now to work with you. Thank you.
Thank you for MasterCard. Any last words before we close the panel?
Yes, thank you. So first and foremost, I would like to say that we together are really impressed and happy to be part of this exercise. It's, I think, for us, at least for our Warsaw office of MasterCard, the first case we have opportunity to collaborate so closely with public sector. We have experience working with municipal organizations, but usually we were working with rather business partners, not so deeply experienced statisticians and analysts. So that was completely different type of dialogue. And we are a bit cautious entering these discussions. And I can only confirm what Marek already said, that we have now full comfort in being sure that we do not have to worry about the usual risk we face. And we are also impressed with the level of engagement and involvement and how important this topic is. That's why we prioritized it in our joint effort. But I think what's important is also looking a bit forward into the future, what we can do together further. And we discussed it a little bit yesterday. And I think the two most important directions for us are, first is looking for new areas where this joint data, ours, but also telecoms data and other data providers can be used to improve national statistics, but also to give back improved information, data, and insights to all stakeholders, so government, the public sector, but also businesses. And looking at these specific topics, but also similar topics, I think we could also, considering that our data, maybe it's not a real-time data, but it's certainly high-velocity data, looking at how we can use it to maybe take a bit of a look in the nearest futures, because we've been even discussing yesterday how our very simple data sets can be used to quickly identify maybe not crises, but changes. The moment they are happening, we see it, for example, in how the consumer basket, spend basket is changing. This can be observed really almost immediately and can be useful even for healthcare. Thank you.
And thank you very much. Fantastic. Dr. Michał Dziedziczelewski, any last words from you? I think he has problems with the line. Okay, so thank you very much, the panelists. This is for the very rich discussion and for the insights of about not just the report, but the methodology and especially the way forward. I think this today what we have seen is a methodology and findings that are groundbreaking, and really the way ahead and the future steps are very clear. And to continue, and maybe next year find ourselves with the next edition of this work. Thank you, and I return to the Master of Ceremonies, Magdalena, the floor. Thank you. Bye-bye.
Thank you very much. Thank you, Paloma. There is only one session ahead of us, but I think that we need a short break for it. I propose that we meet in 15 minutes, so 2:30. 15. We start. Dear guests, it's time for the last session. Now it's time for the voice from the Academy. So I would like to introduce Mrs. Dr. Iwona Bielska and Dr. Iwona Kowalska-Bobko from the Jagiellonian University. Thank you.
Okay, good afternoon. I would like to thank you very much for the invitation for this really very important meeting and the launch of this amazing report. I would like to congratulate on this really amazing source of information about the health of refugees. My name is Iwona Kowalska-Bobko and I am director of the Institute of Public Health, Faculty of Health Sciences, Jagiellonian University Medical College. And I would like to underline that in the Institute, we provide many research on the health of refugees, not only Ukrainian refugees, but refugees. And we also be a part of the project founded by the Marshall Office in Małopolska region. And we prepare together with the researchers from other universities and the specialists of not only health research, but also other fields like education, labor market, the Małopolska strategy of integration of refugees. So I think it's also, as I know, as far as I know, it is the first integration strategy for refugees in Poland. Today, we would like to present for you the outcomes of scoping review on barriers and facilitators to accessing healthcare among Ukrainian refugees. The leader of our research team is Dr. Iwona Bielska, and she's going to present the results of our work.
Hello, my name is Iwona Bielska, and I'm an assistant professor at the Institute of Public Health at Jagiellonian University. I wanted to thank you for the invitation to present the findings from our scoping review here and echo a lot of what was said by Professor Kowalska-Bobko about congratulating you on this report. And as you will see in the results that I'll present, a lot of the findings within the report that was launched are actually very similar to what we found in the published literature from different European countries. So to start, I wanted to present the other co-authors also of the scoping review, Dr. Estera Wieczorek, who's here in the room, Augusta Rebecca James Ravichandran, Mohamed Yasser Esser, and Professor Konrad Pędzi-Piotr. So as many of you in the room and also online know, since the Russian invasion of Ukraine, over 6 million Ukrainian refugees with an overrepresentation of women and children were recorded globally, in addition to 4 million internally displaced persons. And research from the past, looking at refugees from other countries, found that these populations experience various challenges in accessing healthcare systems. As such, it is very important to ensure that healthcare remains accessible to this population internally within the countries that are hosting refugees. So to examine the literature on this topic, to identify facilitators and barriers to accessing the healthcare system, we conducted this scoping review to describe the health and well-being of refugees from Ukraine who are displaced out of the country, to overview the facilitators and barriers to accessing the healthcare system in the host countries by the refugees, and to outline the resulting healthcare system adaptations that were implemented to make sure that the health needs of the refugees were being addressed. So we conducted a scoping review of the literature conducted following the Arksy and O'Malley's methodological framework, and we utilized the PRISMA checklist for scoping reviews. All abstracts and full text papers were reviewed for inclusion by 2 independent evaluators within the research team. So in terms of the inclusion criteria for the review, we focus on papers on refugees from Ukraine. Studies could have been conducted in any country hosting the refugees. We included quantitative, qualitative, and practice analyses, and the publications could be published in any language. In terms of the exclusion criteria, we did not include review papers, opinion articles, editorials, conference abstracts, also non-peer-reviewed reports, as this will be the second phase of our paper. So what I'm presenting today is just on the published papers. And we also did not include papers that were conducted before February of 2022. So to identify the peer-reviewed papers, we searched across 7 Ovid-based databases on March 1st of 2024. So this represented a 2-year period of since the beginning of the large-scale invasion. And databases included Ovid Medline, Ovid HealthStar, Ovid MCare, MBase, AMED, Global Health, and APA PsycInfo. And we supplemented this database search with an internet search for articles. In terms of the search strategy terms, we used different terms to identify the population of interest combined with the word Ukraine. So we included various terms, including refugee, migrant, migration, immigrant, asylum seeker, temporary protection, international protection. We also used a wide range of terms to describe health status, including health, well-being, disease, and medical. And we also tried to identify papers that looked at system adaptation by using very broad terms describing the health system or healthcare or health service. So once we identified the papers, we examined the themes that were presented in them, and we summarized them according to the facilitators, barriers, challenges, and system adaptations that were described. And we present these findings in narrative form. So overall, we identified 688 records through the search of the databases. We found 4 additional papers through an internet search. We removed 302 duplicate records, and we arrived at 390 abstracts that were screened by 2 reviewers. This resulted in 350 abstracts being removed and 40 full-text articles selected for screening. In the end, we identified 20 papers that met our inclusion and exclusion criteria and that were summarized, and I'll present these findings right now. So in terms of the study year of when the papers were being conducted, the majority of the papers the studies were done in 2022, with 15% of the papers being more recent from 2023. We also found that about half of them had quantitative methods, 40% had qualitative methods, and 10% were practice analyses. The majority of the papers came from Poland, representing 40% of the identified studies, followed by Germany, the Czech Republic, Slovakia, Switzerland, Italy, and 1 paper that included multiple countries from the European Union and the European Economic Area. In terms of the setting for where the studies were being conducted, the majority, 35% of the papers were interviews or questionnaires that were conducted in the community, followed by an analysis of hospital data, publicly available data, or data coming from primary care or community clinics, specialized clinics, or triage center. In terms of the medical conditions that were described in the papers that we identified, the majority were infectious diseases at 35% of the papers, followed by 6 papers that were on the general health status of the population, and then papers on oncologic, hematologic conditions, non-communicable diseases, psychological distress, oral health. I will now present the findings from this scoping review, and these are summarized according to 4 overarching categories, including facilitators, barriers, challenges, and system adaptations. So in terms of facilitators, the main themes that we identified included healthcare accessibility and perception of care. So looking at this more closely in terms of healthcare accessibility, individuals were more likely to access care as there was the availability of funded care and health insurance coverage. There was also the availability of specialized healthcare professional services. As an example, the papers mentioned clinics that assisted patients who had a positive HIV status. In terms of the perception of care, individuals that were included in the studies included the quality of treatment and it being high as reasons for why they accessed the healthcare system. Next, I'll go through the barriers, and there are numerous barriers that were mentioned in the papers across the different countries within Europe. And the themes are communication, medical records, patient socioeconomic conditions, healthcare system differences, and system navigation. So you may recall from the report that was launched here that a lot of these themes also present within the report. So in terms of communication, this mostly centered around language barriers between patients and healthcare professionals. For medical records, this included medical records lacking, being incomplete or outdated, them needed to be obtained from Ukraine, or those that required translation. In terms of patient socioeconomic conditions, such challenges were identified as financial, transportation, and housing. For healthcare system differences, the papers identified there being variation between Ukraine and the host countries in health system organization, the availability of medications being different, wait times, and actually these were 2 studies from Germany and Poland identifying that wait times were longer in the countries compared to in Ukraine. Next, there was also different patient expectations related to the treatment or investigations that were being offered, and differences in the relationship between healthcare professionals and patients. In terms of system navigation, this centered around difficulties in navigating the healthcare pathway and not knowing where to seek information to figure out the next steps in the healthcare pathway. I will now present the 3rd category, which includes challenges. So challenges circled around clinical presentation, the need for treatment, healthcare professional workload, and health system pressures. For clinical presentation, individuals who presented in different healthcare facilities often were in psychological distress. So this was something that the healthcare facilities needed to address. Also, some patients had an active infection, as examples, infections such as COVID-19 and tuberculosis were mentioned. Patients also had other infectious diseases and also experienced lower vaccination rates. In terms of the need for treatment, patients often presented with no medication supply or very limited medication supply, necessitating quick access to care. Also, they experience interrupted or delayed care, having come from Ukraine and traveling for multiple days and then trying to identify where to seek help. They also included individuals who needed urgent care, had advanced disease, or multiple comorbidities. In terms of the healthcare professional workload, studies that looked at healthcare professionals mentioned them having longer medical visits as they interviewed the patients to collect the important clinical history. And also healthcare professionals mentioned having a higher number of patients per shift. And here I have a list of the different health system pressures that were felt by the systems and were presented in the articles. First of all, there was a substantially increased volume of patients in a short period of time in multiple jurisdictions, and this presented a significant challenge. There was also a change in the patient profile, as many of the patients who arrived were women, children, elderly. This changed the patient profile that the systems were regularly accustomed to in terms of demographics and diagnoses. As an example, some papers mentioned needing to provide greater levels of obstetrics care. Also, the patients presented requiring additional testing or imaging, and the wait times for this could be longer. Patients also required preventive care, including vaccinations. There were healthcare professional staff shortages. So this one paper that mentioned this actually identified additional healthcare workers from their COVID-19 staff registry. And there was also a lack of healthcare facility space. So lastly, I'll present the different system adaptations that were identified to have taken place in the different jurisdictions. And these centered around communication, information sources, support, access to care, and logistics to ensure that the proper levels of care were provided. So in terms of communication, there were different strategies. The most common was the hiring of interpreters, but also using on-call interpreters and online translators and translating medical records. In terms of information sources, this centered around providing patients with hotlines at the local or national levels, education materials such as handouts, providing websites that provided information on how to navigate the system, and posting on social media. In terms of support, psychosocial support for refugees was provided, but also psychological support for healthcare workers within the host countries. In terms of access to care, there was the development of different procedures and policies within the healthcare system or within individual organizations. There was the availability of medications requiring special funding schemes, and the healthcare facilities assisted the patients in accessing these. There was the coordination of patient transfers and ensuring that similar wait times were found for the local and refugee populations. And actually, the one study that looked at this from Krakow, Poland, noticed that the local and refugee populations had the same access to oncologic treatment in terms of wait times between the two groups. Next, in terms of logistics, the key themes circled around the establishment of appropriate facilities and office space, as well as an increase in healthcare professional staffing levels. So the strengths of this review included being comprehensive and providing an overview of 2 years of studies. And we also did not include any geographic or language restrictions. And in fact, we identified 4 papers that were published in a non-English language. In terms of the limitations of the scoping review, we only searched the Ovid-based databases. However, we included multiple databases from Ovid and also supplemented the information with an internet search. Also, another limitation is that papers continue to be published. So the further we get away from 2022, more papers are being published in the queue, which may require regular updates of the scoping review. And lastly, for this part of the project, we excluded reports from governmental and non-governmental organizations, and we will include these in the next phase of the scoping review. So in terms of the lessons learned that were identified in the papers, this included the systems realizing that a specialized approach to the treatment of vulnerable patients was required, particularly as these patients had been exposed to trauma. They also identified a need for the delivery of culturally appropriate care. They mentioned that baseline assessment of health status and treatment needs needed to be completed at the very outset of the refugees arriving to make sure that their needs were best met. The papers also mentioned the need for reevaluating and adapting procedures with changes in the situation. and establishing procedures and policies at the local and national levels. And lastly, the papers highlighted the need for strong leadership and collaboration between healthcare professionals and also government organizations and non-government entities. So in terms of information that we still need, so gaps in the literature, we found that there isn't much that has been found around the limitations to the comprehensiveness of coverage or the existence of uninsured services. Information regarding the portability of healthcare coverage between jurisdictions for refugees, and information on the accessibility and transfer of medical records between host countries and or to Ukraine with the relocation of refugees. So in terms of future directions for research or practice, there's a need for a continued assessment of the health status of refugees from Ukraine. In particular, the treatment requirements should be periodically evaluated to see if there are any changes that occurred. Chronic health conditions should also be surveyed to see what the situation is looking like in the years to come. Also, the changing epidemiological situation of infectious diseases should also be monitored in the years to come. Lastly, there's a need to keep the emergency preparedness procedures and protocols up to date in case there are any changes to the situation. So in conclusion, the review that I presented today overviewed numerous facilitators and barriers to accessing the healthcare system. It also overviewed the challenges that were experienced by the patients, as well as pressures on the healthcare system that required system adaptation and resilience. And also, we identified some areas that have not yet been studied and that could lead to future analyses. So here's a list of the 20 studies that we included in our review, and thank you very much for listening to the presentation.
Thank you very much. Now I would like to ask whether there are some questions or reflections that you would like to share, including online, of course. Please raise your hand if you're online.
Hi, Paloma here.
Please.
So thank you for excellent job. This absolutely amazing, cannot be overestimated from our point of view. From my point of view, because I am a member of academic society and I realize that the first thing that needed to be done just before doing something is, this literature review, and so some kind of inventory of literature. And so it is, for us, it is some kind of tips for strategy for preparing next steps to develop, enhance our questionnaire, areas of study, of, survey, etc., etc. So I'm flabbergasted. Thank you.
Thank you very much for the comment.
Thank you. I think we've got some voice from the audience online. Paloma, would you like to comment?
Yes. Yes, thank you. Thank you for giving me the floor. No, fantastic. Really impressed with the work. I really like it. And like Marek was saying, I already keep on thinking of things that should add in next rounds of future work with the refugees. I wanted to ask the researchers, by going through this review, do you have a sense of the differences in the refugees, not this heterogeneity that we've been picking up? Do you see a difference between refugees staying longer in Poland or that have a different geographic location, or that the length of stay is having an impact in the studies. And if you didn't pick them up, do you think it will be worth it to look at this, like the patient journey or the refugee journey? Do you think it will have an impact in the results? Thank you, and back to you.
Thank you very much for the question. Definitely, I believe that the situation warrants a review of the patient pathways over the last 2 years. In the studies, since most of them were conducted in the year 2022, we actually don't have much information about term situation of the patients. If I can recall, there was a study that looked at a 6-month and also a 1-year review of the situation of the patients. And presented the results, but actually there are very minimal amount of studies on this topic, and definitely, as you said, this is important to examine. Also, the majority of the studies were conducted in very specialized settings or clinics. Not many of them were conducted among the general population. We may find that by doing the second part of the project, which is a review of the different reports, including the report that was launched here, that we will identify some of the gaps that the published literature hasn't yet captured. And I'll open it up to the other co-authors for comment.
Okay, I think I agree with everything what Ivana said, and that's the problem, that most of the studies that we included so far in the scoping reviews is coming from 2022, and therefore we are waiting also to include, to second phase and include the reports.
Thank you very much. I'm very much looking forward to see the paper. Thank you.
Thank you.
Yes, we are going to publish it soon.
Dr. Belizzi, please.
Just a quick comment, because I see a lot of synergy between what you are doing and the initiative led by the Statistics Office. Why? On one hand, some of the findings are very converging, specialized care. This was one main finding on the trend of refugees here, and you found as one of the main findings. Second point, you identified different areas for further research. For this, you need data. So it's an additional justification to search potential other sources to be integrated with the methodology that was utilized in the experience up to now. So I see a loop here where all these actors really streamline in a synergic way can bring this further. Thank you.
Thank you for the comment. And yes, we're investigating different possibilities for conducting quantitative and qualitative research within Poland and also outside of Poland to further examine the situation.
Thank you very much. Are there any other comments or questions? I cannot see any, so now I would like to give the floor to Dr. Dominik Roskroot, the President of Statistics.
I guess I'll stay here. That's going to be easier. And I have a comment, but I kept it for the closing remarks. I mean, that's very informative for the work also that we've been doing here. And of course, that brings a lot of ideas in terms of like, how can we expand on the work that we've done so far? And another advantage of the work that you've done is kind of like you're attracting attention of all those authors of those reports, that there's some other work being done and they can learn from each other, or maybe also consolidate or cooperate in this regard. So that's very promising. Thank you very much for that. It's really, it's very useful. I mean, there's a lot of things coming to us already, to our heads. Marek has mentioned that. We will certainly try to take advantage of your work as well. And then, of course, it's not a secret. We aim at kind of like collaborating together. We've been trying already like twice, applying for some big project together with the Jagiellonian University and our office, regional office in Krakow. Agnieszka Szlubowska, who is the director, is also with us today because they're specializing in health statistics. They do a national health account. And I think that there's a lot of opportunities coming for us to collaborate in both this project and the other projects in terms of producing, insightful health-related statistics. And that's really something that is very promising. And I'm kind of about to close today's seminar, having this good feeling that even better things are coming. So thank you very much. It was very insightful, impressive. Thank you for that. And thank you for taking the effort to come to us today from Krakow. It's, of course, it's easier than from Szczecin, but it's still quite an effort, and you are here with the whole team, so that's very useful for us. Thank you very much, and we're happy that we can share also and further improve our collaboration. And just to finish the seminar, I'd like to thank again every participant, those that were actively involved, but also all of you, the people that have been carefully watching what we have to say. And I think a lot of useful work has been done. We will try to communicate it further and to disseminate the data. And of course, I would like to encourage you to take a look at our dashboard that we have just opened up today. That's very useful. It's not our last word. I can promise that we will try to deliver more. And thanks to all of you for this, collective engagement. We're looking forward to seeing you soon. Thank you.
So I would like to officially close today's conference, and I would like also to invite you to study the report that soon will be made available on our website. Thank you very much.